If you're researching dental implants, all on 4, all on X, or teeth in a day, one of the biggest mistakes that you can make is assuming every single dental office is offering the same thing, because they're not, okay? Two offices can both say that they do all on 4, but the experience, the planning, the materials, the final teeth, your timeline, and your long-term support can be so different. So in this video, I want to walk you through the 5 questions that I think every patient should ask before choosing a dental implant provider. Because this is a big decision, right? You're going to trust someone with your smile. You're going to trust them with your health, your mouth, your ability to eat comfortably. You should know exactly what you're getting yourself into. My name is Dr. Chris Bano. I'm a dentist here at Centerville Family Dentistry and Implant Center in Centerville, Michigan. At our office, we focus heavily on dental implants, from single teeth to full mouth implant solutions like these. And after helping hundreds and hundreds and hundreds of patients replace missing teeth, fix loose dentures, get their confidence back, these are the questions that I would want my own family to ask before moving forward with treatment. So let's get into it. Let's start with the first question. The first is, how much experience does this doctor have with this specific procedure? And I want to make it clear, this doesn't just mean, does the doctor place implants, right? Because that's just one thing. But if you're looking at full mouth implants, it's a much bigger procedure than placing one implant. With the full arch case, we're going to look at removing teeth, looking at the bone, the bite, the smile design, the surgical plan, your temporary teeth, and then your final teeth. So you want to know, does this doctor do full mouth implant cases regularly, or do they just do the surgery? Can they show examples of their work? Do they have patient reviews or video testimonials? Does this doctor understand both the surgical side and the teeth side, right? Because that's very important, because with all on 4, all on X, placing implants is just one part of it. The implants have to be placed in a way that supports the teeth, okay? The bite has to be designed correctly. The smile has to match the patient's face, and the final teeth have to be made in a way that is cleansable and comfortable long-term, okay? So before choosing your provider, do your homework. Look at their website, look at their reviews, look at their videos, look at their patient stories. And then ask yourself, does this office actually do this often? Or is this something that they only do maybe once in a while, right? Because experience here matters so much, especially when you're trusting someone with such a life-changing procedure. And then question number 2, what type of teeth are you actually getting? Because this is one of the biggest things patients don't realize. All on 4 is not one single product. It's just a concept, right? It means implants are being used to support a full arch of teeth. But the actual teeth on top can be very different depending on the office. Some offices use like acrylic teeth or acrylic with a reinforced bar. Some use other materials, and then some use zirconia with a reinforced bar. So when you're comparing treatment options, you don't only want to ask, like, how much does it cost, right? You want to ask, what are my temporary teeth made of? What are my final teeth made of? Are the final teeth going to be zirconia or something else? And are they digitally designed? Where were they made? How are they made? Are there any warranties if something breaks? Because 2 treatment plans can sound very similar on a sheet of paper, right? But they can be very, very different at the end. At our office, for many of our full arch implant cases, our final teeth, just as you see on these models, are made from zirconia with a titanium bar for support. The strong zirconia on the outside and the strong support on the inside. And they look very beautiful when designed properly, and you're going to have a beautiful smile. And for a lot of patients, there is a major difference with these implants, especially compared to dentures. Now, every patient is different. Not every material is right for every single situation, okay? But you should at least know what is going into your mouth, because this is not just the surgery, like I said. This is a new set of teeth that you're going to smile with, you're going to chew with, you're going to live every single day with. And that's ultimately what you care about. Now, the third question is, what happens if something doesn't go as planned or perfectly? And this is what I call a backup plan. And honestly, this is one of the most important questions to ask, because with any surgical procedure, there are going to be speed bumps. An implant may not heal properly. It may not heal at all. It may fail. A temporary bridge may break. A patient may need more healing time. The bite may need to be adjusted. Gums may shrink as you heal. That doesn't mean the case fails completely, but it does mean the office needs to have a plan. And this is one of the biggest reasons I tell patients, please don't go abroad. So ask, what happens if an implant fails? What happens if my temporary teeth break? What happens if something feels off after surgery? What is covered? What isn't covered? Who's going to be taking care of me? What kind of maintenance do I need long-term? Because dental implants are a long-term solution, okay? There are not these things that are just maintenance-free and you're just buying them and then you're done with it. You still need cleanings. You still need checkups. You still need to keep the tissue healthy. You still need a team that knows how to maintain this type of treatment. At our office, we just try to be very upfront about this. We want patients to understand Not just the exciting part of getting the fixed teeth, but also what it takes to protecting them and protecting your investment long term. Because a great implant case is not just about surgery day, right? It's about having a plan before the surgery, during, and most importantly, after. What happens after? And then the fourth question, what does the full timeline look like, start to finish? This is where a lot of patients get confused because they hear terms like teeth in a day and they assume the entire process is finished in one day. That's not exactly how it works, aside from a couple offices, but I'm not going to get into that here. In many cases, we can remove the failing teeth, place the implants, and give patients a fixed set of temporary teeth, kind of like these ones, the same day. And that means you don't leave without teeth, and you don't have to go through the healing phase with like a loose denture bouncing in there. But those same day teeth are usually temporary teeth. They're designed to get you through the healing phase and while the implants integrate into the bone and the gums settle. And then after the healing period, we start designing the final teeth. So when you're choosing your dentist, ask what happens on surgery day. Will I have fixed temporary teeth? How long do I wear them? When do we start making the final teeth? How many appointments are involved, start to finish? What happens at every single visit? Because a good office should be able to easily walk you through the entire process clearly. At our office, we explain the treatment in phases: the consultation 3D scan, the planning, the surgery, the temporary teeth, the healing period, and then the final zirconia teeth. That way patients understand what to expect and they don't feel like they're guessing or they have no idea what's going on. Because even though the surgery may happen in one day, the full transformation is a process. And you want to be in an office that has that process dialed in. And then the last question, question number 5, does the whole office understand the implant treatment? And this is something people don't think about, right? The doctor matters a lot, but the doctor is not the only person involved in your care. When you go through a full mouth implant procedure, you're also working with the assistants, the treatment coordinators, the front desk team, the lab team, and the people helping you before and after the surgery. So the overall team matters a lot. When you walk into the office, pay attention to how everything is organized. Does everyone answer your questions easily and clearly? Do they understand the procedure? Do they explain the financial options? Do they walk you through what happens after surgery? Do they make you feel rushed, or is it like a very comfortable environment? You want a team that knows how to guide you through that entire process. At our office, again, this is a major part of what we do, and we stand behind it. Our team is used to helping patients who are nervous, embarrassed, overwhelmed, or unsure, okay? And that's what matters at the end of the day, because for most people, this treatment is not just about replacing teeth. It's about being able to smile again, eat again normally, not think about their teeth. So yes, a doctor's experience matters, but the team, the systems, and the overall experience matters so much more. So if you're researching dental implants, let me recap this for you. Before choosing an office, number 1, ask how much experience does the doctor have with this specific procedure? Number 2, what type of teeth am I actually getting? Like what material am I getting? Number 3, what happens if something doesn't go perfectly or according to plan? How am I covered? Number 4, what does the full timeline look like, start to finish? And then number 5, does the whole office understand the implant treatment process? Because dental implants and the treatment itself is a big decision, and you should not feel confused, pressured, or rushed into it. You should understand the plan, understand the materials, understand what's going into it, timeline, the maintenance, and you should feel comfortable with the people who are taking care of you. Again, at our office, we walk the patients through every single step. We take a 3D scan, we look at the bone, we look at, most importantly, your goals. We talk through your goals, we explain your options, and we show you what actually makes sense for your mouth. So, if you've been thinking about dental implants and you made it this far, or you've been told that your teeth are failing, and you're not sure what to do next, reach out to our office. Even if you're just starting to research, it's completely fine. Just reach out. We can at least help give you some clarity. Until then, I'll see you in the next one.